You're staring at that positive pregnancy test, and suddenly 9 months feels like both forever and no time at all. You know your body is about to change, that your baby is growing, but what actually happens during first trimester versus second versus third? When does morning sickness peak? When will you feel those first kicks? When do you need those important tests? If pregnancy feels like stepping into unknown territory with a vague map, you're not alone. Most women know pregnancy has 3 trimesters, but the specifics of what changes when often remain mysterious until you're living through each phase. If this video helps you feel more prepared for your pregnancy journey, subscribe for more evidence-based pregnancy health content you can trust. Today, we're walking through all 3 trimesters from conception to delivery. We're breaking down exactly what's happening with your baby's development, what changes you'll experience in your body, which symptoms appear when, and what medical milestones to expect. By the end, you'll have a clear timeline, replacing confusion with confidence. Think of this as your roadmap for the entire journey ahead. Let's start with the first trimester, which covers weeks 1 through 12. This is what doctors call the foundation phase. And here's what makes this period remarkable. Your baby goes from a single cell to a fully formed miniature human in just 12 weeks. That tiny poppy seed-sized embryo at week 4 becomes a lime-sized baby by week 12, with a beating heart, developing organs, and recognizable features. The neural tube that becomes your baby's brain and spinal cord forms during weeks 5 and 6. By week 8, your baby's heart is pumping blood. By week 10, all major organs have begun developing. This is the most dramatic period of development in your baby's entire life. And your body? It's working incredibly hard to support this rapid growth. You're experiencing a massive surge of hormones, specifically HCG and progesterone. These hormones are doing critical jobs, preparing your uterus and supporting your baby's development. But they also cause many of the symptoms you're feeling. That overwhelming exhaustion you might be experiencing, that's progesterone. The nausea and breast tenderness, that's primarily HCG. The frequent trips to the bathroom, or your uterus is already expanding and pressing on your bladder. Your body is designed for this work, but it's intense biological work nonetheless. This is also when you'll have your first prenatal appointments. Your healthcare provider will confirm your pregnancy, establish your due date, make sure the pregnancy is in the right location, and begin baseline testing. You'll likely have blood work checking your blood type, iron levels, and screening for various conditions. And understanding what's happening helps you know what questions to ask and what information matters most. Now let's talk about what this first trimester actually feels like day to day, because the timeline matters here. Morning sickness typically peaks around weeks 9 and 10. This is when nausea often feels most intense. But here's the encouraging part. For most women, it starts improving around week 12 to 14. Knowing there's a predictable endpoint helps you get through the hardest days. You're not imagining how difficult this feels, and it won't last forever. The first trimester also carries the highest risk for miscarriage, and we need to talk about this honestly. About 80% of pregnancy losses occur before 12 weeks. This statistic causes understandable anxiety. But here's the important context. Once you hear your baby's heartbeat at an ultrasound, which typically happens between weeks 8 and 10, your risk drops significantly. After 12 weeks, it drops even more substantially. Each milestone you pass increases the likelihood of a healthy, continuing pregnancy. Your anxiety about this is completely normal and valid. Your first ultrasound usually happens between weeks 8 and 12. This is when you'll see your baby for the first time and hear that heartbeat. Between weeks 11 and 14, you may be offered first trimester screening, which checks for chromosomal conditions. Your provider will discuss these options with you and help you understand what testing makes sense for your situation. Here's something else that's completely normal during this phase. Many women don't show yet. Your pregnancy might feel surreal because there's no visible proof. You're feeling significant symptoms, but to the outside world, nothing has changed. And that disconnect between how you feel internally and how you look externally is a common first trimester experience. Then comes the second trimester, weeks 13 through 27. This phase is often called the honeymoon period or golden period of pregnancy, and there are good reasons for that. For most women, morning sickness resolves. Your energy returns. You develop a visible baby bump, but it's not yet so large that it's uncomfortable. Many women describe this as the phase where they feel most like themselves while being pregnant. Your baby is growing rapidly now, from about the size of a peach at 13 weeks to the size of a cauliflower by 27 weeks. Your baby is developing fat stores that will help regulate body temperature after birth. The ears are developing, and your baby can begin hearing sounds from the outside world. And here's one of the most magical milestones of pregnancy. Somewhere between weeks 16 and 25, you'll feel quickening. That's the term for the first movements you can detect. It might feel like butterflies or gentle bubbles at first. These movements will become stronger and more defined as weeks progress. Between weeks 18 and 22, you'll have your anatomy scan. This is a detailed ultrasound where a technician examines your baby's development thoroughly, checking organ formation, growth measurements, and overall development. But many parents choose to find out their baby's sex during this appointment. This is also an important medical milestone, giving your healthcare team detailed information about how your baby is growing. Between weeks 24 and 28, you'll have glucose screening for gestational diabetes. This involves drinking a sweet solution and having your blood sugar tested. Gestational diabetes affects how your body processes sugar during pregnancy, and catching it early allows for management that protects both you and your baby. The second trimester is often when your pregnancy becomes visible to others. You're showing, people start commenting, and your pregnancy feels increasingly real. This is also the phase where you'll likely feel your best physically, making it an ideal time for certain activities and preparations. Your body is changing in noticeable ways during these middle months. You might experience round ligament pain, which feels like sharp twinges or aching in your lower abdomen or groin. This happens because the ligaments supporting your uterus are stretching as your uterus expands rapidly. It's completely normal, though sometimes startling. You might notice skin changes too. A dark line called linea nigra may appear down the center of your belly. Some women develop melasma, darkened patches on the face. These changes are hormonal and typically fade after pregnancy. You might also start feeling Braxton Hicks contractions during the second trimester. These are practice contractions where your uterus tightens briefly, then releases. They're usually painless or mildly uncomfortable, irregular, and don't increase in intensity. They're your body's way of preparing for labor, even though labor is still months away. Here's something partners often love about the second trimester. Your baby's movements become strong enough that other people can feel them from the outside. Placing a hand on your belly and feeling your baby kick creates powerful bonding moments for partners and family members. This is also your window for major preparations. This is the time to set up the nursery, register for childbirth classes, and select a pediatrician. Your energy is back, you're mobile and comfortable, but you're visibly pregnant enough that everything feels real and motivating. And many couples schedule baby moons during the second trimester for exactly these reasons. You feel well enough to travel, but you're not yet in the phase where airlines restrict flying or long car rides become uncomfortable. Then comes the third trimester, weeks 28 through 40. This is the home stretch, the final phase before you meet your baby. And it's characterized by your baby's major growth phase. Your baby will gain most of their birth weight during these final weeks. At 28 weeks, your baby weighs around 2.5 pounds. By 40 weeks, average birth weight is 7 to 8 pounds. That's substantial growth in a relatively short time. Your baby's lungs are maturing during these weeks, developing the surfactant needed to breathe air after birth. The brain is developing rapidly with billions of neural connections forming. Your baby is also getting into position for birth, typically rotating head down sometime between weeks 32 and 36. Your provider will check your baby's position at appointments during this phase. And your body? You're likely experiencing the return of fatigue. You're carrying significant weight now. You're probably experiencing frequent urination again because your baby is pressing directly on your bladder. You might feel shortness of breath because your expanding uterus is pushing up on your diaphragm, and you're leaving less room for your lungs to fully expand. Swelling in your feet and ankles is common as your body retains more fluid. Braxton Hicks contractions often increase in frequency, and sleep becomes genuinely challenging. Finding a comfortable position is difficult, and you're waking frequently to use the bathroom. These discomforts are real and legitimate. They're also serving purposes. Your baby's growth is pushing on your organs because your baby needs that growth for health and development. Your body is preparing for labor through those practice contractions. Understanding the why behind discomfort doesn't eliminate it, but it provides helpful context. Your appointment frequency increases during the third trimester. Starting around week 28, you'll typically see your provider every 2 weeks. After week 36, appointments usually shift to weekly. This increased monitoring allows your healthcare team to track your baby's growth, monitor your blood pressure, check for swelling, and ensure everything is progressing normally. Around week 36, you'll have a test for group B strep, a common bacteria that, if present, requires antibiotics during labor to protect your baby. Now let's talk about the countdown to birth, because the final weeks of pregnancy have their own timeline and milestones. A term pregnancy is considered anywhere from 37 to 42 weeks. Early term is 37 to 38 weeks. Asha's full term is 39 to 40 weeks. This is why your provider isn't concerned if you reach your due date and nothing happens yet. Your body and your baby are working on their own timeline. There are signs that labor is approaching, though they don't predict exactly when. Your baby may drop lower into your pelvis, called lightening. You might notice this as easier breathing but increased pelvic pressure. Your cervix begins changing, softening and thinning, which your provider can assess at appointments. You might lose your mucus plug, which looks like thick, sometimes blood-tinged discharge. Many women experience a nesting instinct, a sudden burst of energy and desire to clean and organize everything. Most providers recommend having your hospital bag packed by 36 weeks. This ensures you're ready whenever labor begins. This is also when you'll finalize your birth plan and discuss it with your healthcare team. Clarifying your preferences for pain management, delivery positions, and immediate postpartum care. The final weeks often feel long. You're uncomfortable, you're eager to meet your baby, and every day past your due date can feel frustrating. This impatience is universal and completely understandable. It's also important to understand the difference between false labor and true labor. False labor involves irregular contractions that don't increase in intensity or frequency and often stop with movement or rest. True labor involves regular contractions that get progressively closer together, longer and stronger, and don't stop with position changes. Here's something crucial to understand about everything we've just covered. While these trimester patterns hold true for most pregnancies, individual experiences vary significantly. Some women never experience morning sickness. Others feel nauseous throughout their entire pregnancy. Some women feel movements as early as 16 weeks. Others don't feel anything until 23 or 24 weeks. Some women show obviously by 14 weeks. Others stay small throughout. Pregnancy length varies naturally too. Going into labor at 37 weeks is just as normal as going into labor at 41 weeks. Your pregnancy might not match textbook descriptions perfectly. That doesn't mean something is wrong. Every pregnancy tells its own story. Even the same woman can have completely different experiences with different pregnancies. What matters is that you understand the general timeline and typical patterns so you know what's within the range of normal, while also trusting that your specific experience is valid regardless of how closely it matches these descriptions. Your body is designed for this journey. These trimesters represent a choreographed biological process that has been happening for all of human history. The changes you're experiencing serve important purposes. The symptoms you're feeling have explanations. The timeline you're following has predictable milestones. You're not walking through this blindly anymore. You have a map now. You know what's happening in first trimester, what to look forward to in second trimester, and what to expect during third trimester. You understand when tests happen, when symptoms typically peak and resolve, and when your body will need different types of support. Knowledge is power in pregnancy. Understanding what's coming doesn't eliminate all uncertainty, but it transforms that uncertainty from overwhelming to manageable. You'll recognize what's normal. You'll know what questions to ask your provider. You'll understand what phase is best for which activities and preparations. And perhaps most importantly, you'll feel confident that your body knows what it's doing. You're growing a human being and you're doing it exactly as you're meant to.